Hi everyone, Dr. Jay Mehta here. I head the Chronic Pelvic Pain and Neuropelveology Clinic here in India. Today I'm going to be speaking about something which is absolutely mandatory part of chronic pelvic pain treatment, especially for idiopathic chronic pelvic pain, for post-surgical chronic pelvic pain, and for women in whom a diagnosis is done, treatment is done, but they continue to have chronic pelvic pain, and that is cognitive behavioral therapy. What is all these things, right? Remember, guys, when you've suffered for pain for such a prolonged period of time, what happens is your body pathways start to treat every signal as a pain signal. That is because just let's me put it this way, that there is some loose connection somewhere or some bigger hyper connection somewhere. Now, because of this, what typically happens is your brain starts to interpret every normal signal as a pain signal, and you continuously stay in pain despite having done the correct treatment. This is where the role of a multidisciplinary team of a gynecologist, neurologist, psychologist, behavior specialist, and pain management specialist, 5 people together come in. This therapy allows us to teach you about your disease and simultaneously allows us to process your pain signals in a much better manner. This is, of course, in combination with a good sleep, good breathing exercises, and medications which may help you calm down your nerves. Mind you, these are not sleep medications, okay? These are quite a lot of times simple nutraceuticals. But this therapy takes minimum of 12 to 16 weeks. It is a time consuming effort. It does not happen overnight. Women are taught how to respond to pain. Women are taught how to maintain a pain diary. Women are taught how to make sure that their pain signals get compressed. It takes some time. And once it takes some time, over a prolonged window, it requires multiple follow-up sessions. Believe me, for all women who have so far undergone CBT at our unit, the quality of life improvement is between 70 to 90% after 6 to 8 months of undergoing this therapy. Of course, guys, when we make you undergo this therapy, we've made sure that everything else is clean. Pelvis is clean, there is no endometriosis, there is no adenomyosis, no PID, no inflammation, no disease, nothing. Your body is a clean slate, and that is when you start giving the patient this therapy. You cannot give cognitive brain therapy or behavioral therapy to patients who are having an active disease. This is where the role of going to a good referral clinic for chronic pelvic pain and neuropelveology is extremely important, because we are able to pinpoint your diagnosis, treat the diagnosis, and then put you on a long-term therapy. A lot of women in our country require this. A lot of women approach us for this either in our OPD or online. I encourage each and every one of you who suffers from chronic pelvic pain to go to a specialist, get your life sorted.